Stillbirths are when the fetus dies after 20 weeks of pregnancy. Usually affects 3 in 1,000 pregnancies in developed countries and about 29 in 1,000 pregnancies in sub-Saharan Africa. The why of stillbirths can be classified using Wigglesworth Aberdeen's record of fetal neonatal classifications. We'll be using the relevant condition at death classification. The record categories include fetal category, umbilical cord, placenta, amniotic fluid, uterus, mother intrapartum, trauma, and unclassified causes of stillbirth. Fetal categories, we can have lethal congenital abnormality that was able to survive for the first 20 weeks, but now is no longer able to survive. Then we have non-immune hydrops. This is a situation where we have the baby not being able to manage fluid, so fluid accumulates in cavities causing swelling. Like the baby can have under the skin accumulation of fluid called edema. If it accumulates in the abdominal cavity, it will be called ascites, and this is going to lead to death. Infections, acute or chronic, could be viral, bacterial, among others. Isoimmunization, this is a situation that usually involves rhesus antigen. This is an antigen that is on red blood cells that gives us, for example, when you're blood group A, you can be blood group A positive, meaning you have rhesus antigen, or blood group A negative, which means you do not have the rhesus antigen. If you don't have the antigen, normally you will produce what we call antibodies that fight the rhesus antigen. So if a mother is rhesus negative and a father is rhesus positive, then they get a child who is rhesus positive, then there is a possibility that the mother is going to fight. You see, they can produce antibodies against the rhesus inside the fetal blood. So once there is the production of antibodies against the rhesus factor in the fetus, in subsequent pregnancies, usually the first pregnancy is not affected, but in subsequent pregnancies, we will have a lot of antibodies that are going to cause hemolysis on the red blood cells of the fetus, causing anemia and death. We have fetal maternal hemorrhage. This is where the fetal blood and red blood cells drain into the maternal circulation in large quantities, because in low quantities it doesn't cause any lethal effects. Growth restriction occurs in multiple pregnancies, such that some fetuses are not able to grow well and they can die. Fetal growth restriction, here is where a fetus is not able to gain the normal birth weight because of factors such as medication, smoking, alcohol, among others. Umbilical cord, we can have a prolapse. This is when the umbilical cord comes out fast during birth or just before birth into the vaginal cavity, and once it has come out fast, the baby might be restricted to come out, or it could curve around his neck and so on and so forth. A constricting loop or knot on the umbilical cord, we can have a knot on the umbilical cord, and this will mean there will not be supply of oxygen and nutrients. We could also have the umbilical cord thickening because of various factors, and this will also reduce the flow of nutrients and oxygen. Velamentous insertion, usually where your umbilical cord is, it rises directly from the placenta. But now if it doesn't rise directly, it comes through the membrane of the amnion sac, it will mean that there is a portion of the umbilical cord that is not protected, and it could be prone to rupturing and cause lack of supply to the fetus and death. Placenta abrasio is where the placenta detaches from the womb before birth, and that will mean that there is no nutrients going to the child. Placenta praevia is a situation where now the placenta is on top of the inner wall of the cervix, and this situation is dangerous because only through cesarean section can you give birth, because you do not want to suffocate the child before it has totally come out. Then vasa praevi is a situation where we have blood vessels on the inner wall of the cervical cavity. And you see now, once they are inner the cervix, it will mean that if there is any rupturing, especially during labor and birth, then there will also be suffocation of the child because of lack of nutrients. Placental insufficiency are situations where the placenta did not develop properly and therefore less supply of nutrients. Amniotic fluid causes. Chorioamnionitis is a bacterial infection that will affect the chorion and the amnion membranes and therefore affecting the child and can lead to death. Oligohydramnios is a situation where you have too little of the amniotic fluid at a certain point of the gestation period, and this will be dangerous for the fetal growth. Then poly is where we have excessive amniotic fluid at a certain gestation period, and this will mean it's also too much for the growth of the fetus. Utero causes, it could rupture because of either trauma or previous cesarean section, or uterine anomalies. We talked about uterine anomalies, congenital and acquired, that cause miscarriages. They could also cause stillbirth. Mother factors, we can have chronic conditions like hypertension, diabetes, thyroid disorders, autoimmune diseases that will cause a stillbirth. We can also have misuse of drugs, either alcohol or medications, and that misuse is going to also cause death. Intrapartum, this refers to during labor, where now here we have low oxygen supply, and this will cause either an abnormality like cerebral palsy, or we can have death of the fetus, or birth trauma in prolonged labor. Trauma can be external, maybe an accident, or iatrogenic, and this is caused by treatment of certain diseases. Let's say when you undergo radiotherapy, chemotherapy, that can cause trauma to a fetus and death. We also have what we call unclassified, and unclassified can be either because we have no relevant condition identified or because there isn't any information available. The most frequent types of stillbirth according to gestation age, usually at 24 to 27 weeks, the infection is the highest cause, abrasio placenta, and then congenital anomalies that usually have proceeded from before 20 weeks, because we said before 20 weeks, these are the most causes of miscarriages. Then we have 28 to 37 weeks, most of them are unexplained. Then fetal malnutrition could be because of umbilical cord challenges, placental insufficiency, such that the child is not able to get the required nutrients, and also abrasio of the placenta when it detaches before time. Then we have 37 weeks onwards until birth. We also have quite a large unexplained 40% cases of stillbirth. We also have fetal malnutrition and abrasio placenta.